Predefinito. Did you know that abruptio placentae, a rare but serious condition of pregnancy, is a premature separation of the placenta from the uterus? This condition can lead to severe complications if not treated immediately, but with prompt medical attention, the risk can be effectively managed. The exact cause of abruptio placentae is unknown, but it could be due to an injury to the abdomen or rapid loss of amniotic fluid that protects the fetus. Symptoms include vaginal bleeding, abdominal pain, back pain, and uterine contractions. It usually occurs in the last trimester of pregnancy. Diagnosis includes physical examination and tests such as blood tests, urine tests, and ultrasound. Treatment depends on the degree of placental separation and the pregnancy week. It may involve bed rest, labor induction, or cesarean section. If left untreated, complications may occur to the baby, including blood loss, kidney failure, restricted growth, insufficient oxygen supply, premature birth, and stillbirth. Considering the potential risks, do you think it's crucial for pregnant women to have regular checkups to detect such conditions early? And how do you think society can raise awareness about the dangers of untreated abruptio placentae? The most controversial comment will be pinned at the top. Subscribe to the channel and activate the bell for daily health news.